Hey gang, welcome back to my channel. If you're watching this for the first time, then I would like to introduce myself. My name is Marii Opara. And if you're back again to watch another video, then hey! Okay, so today I want to talk to you about UTIs. And a UTI stands for urinary tract infection.
Yeah, this is my palace. Champagne in my chalice. I got it all covered like a wedding band. Wonderland, so my alias is Alice.
Okay, so a UTI. That stands for a urinary tract infection. And the NHS approved patient definition for a UTI is a bacterial infection that occurs anywhere from the urethral opening to the urethra, the bladder, and way up to the kidney, therefore anywhere along your urinary system. The prime culprit for UTIs is E. coli, which often resides in the anus. There's this common misconception that men do not get UTIs, but they do. It's just more common in women. And this is because the proximity between the anus and the urethral opening in women is a lot shorter than in men. Also, the length of the urethra in women is a lot shorter than in men, which means that bacteria has a much shorter distance to travel in order to cause an infection. I'm sure this goes without saying, but it's very important to treat a UTI as soon as you notice the symptoms. So, notice the symptoms, go and see a doctor, get it treated. And this is because an untreated UTI leaves you vulnerable to the risk of kidney damage and blood poisoning. So you're probably sitting there wondering, what does an infection in the waterworks have to do with poisoning the blood? Well, actually, that's because the kidneys are the filtration system of the blood for the body. So if your kidneys aren't working properly, then your blood's not going to be properly cleaned. So I guess you can see how a UTI could mean that you're in trouble. The British National Formulary have recommended a 3 or 7 day course of antibiotics as treatment for uncomplicated UTIs, so not cranberry juice. For some women, antibiotics treatment can often result in something called thrush. If you'd like to know a bit more about thrush, please follow the link below to my previous video where I spoke to you about how to identify the symptoms of thrush, how to treat thrush, and also how to prevent any future recurrences. So now, how can you tell if you have a UTI? Well, one of the symptoms is increased urgency. This means the need to go to the toilet really bad, like really bad. Also, you have increased frequency, which means you probably go more often than you normally would. Another is a burning, painful feeling every time you try to go to the toilet. You may also experience smelly and cloudy pee, or even see a little bit of blood in your pee. Some people will also get lower abdominal pain. In most women, it's almost like a period pain. For men, it's a foreign concept, but you'll feel it. Older people may become confused. Babies tend to be a bit more irritable. They won't feed as well. They'll be generally unwell, and they may also spike a temperature of about 37.5 or higher. So lastly, but just as promised, 5 ways to prevent the reoccurrence of a UTI. Number 1, women, please wipe from the front to the back. Don't wipe from the back to the front. This is because you are dragging the bacteria from your anus, giving it a free ride straight to the urethral opening and up the urethra to cause an infection. So please wipe from the front to the back. Second reason, aim to clean your genitals at least once a day. If you watched my previous video, I do recommend using water, but other recommendations are to use unperfumed, chemical-free soaps. Number 3, try to pee immediately after sex. Number 4, drink plenty of water every day. There is no recommended amount of water you should drink on a daily basis. But the Center for Disease Control and Prevention linked in a study that showed that the average daily intake of fluids from everything, that's from water, from juice, from the food we eat, should be about 2.7 litres for women and 3.7 for men. But if I was to give you a rough estimate, I'd probably say aim for about 2 litres of water a day. That's a good number to go for. So finally, my last tip of today, if you can avoid it, do not hold in your urine. If you feel the urge, just go with the flow. Well, that's all, folks. Thank you guys so much for watching. If you enjoyed watching this video, then please like, subscribe, and share. Tell your friends, tell your mama, tell your brother, tell your sister. And follow me on my socials. I'm on Instagram as Marii Opara. I hope to see you soon. Bye.